name's Nolan Gugzel. Today we're going to be going over the nasotracheal suction competency. So the first thing we want to do is we want to evaluate the patient for signs and indications of the procedure. So in this case, audible secretions and inability of clearance of the secretions with their best cough. We're going to want to check the patient's chart for any pertinent information or physician orders. After that, we're going to want to go ahead and gather supplies. In most cases, it'll be in a kit, but if not, we're going to want our suction catheter. We're going to want water, saline, or normal sterile water. We're going to want a basin, lubricant, suction. We're going to want sterile gloves. We're going to want oxygen, BVM, and our stethoscope and appropriate equipment for vital signs. After that, we're going to go ahead and enter the patient's room. We're going to wash our hands as we enter. We're going to introduce yourself. Hello, my name's Nolan. I'm one of the respiratory therapy students. Today we're going to be going and doing some nasotracheal suctioning. It's going to help clear the secretions from your nasal passage and from your airways. Help you breathe a little bit more easily. Is that all right with you? Okay. If you feel short of breath at any time, abnormally uncomfortable, unbearably uncomfortable, go ahead, let me know, and we'll discontinue this at all time. Confirm understanding with the patient and family members. Gonna go ahead and grab 2 sets of identification for you, so first and last name as well as date of birth. Confirm those. Right patient, right ID. This time I'm gonna go ahead and wash my hands again. I'm gonna go ahead and lay the patient back into a sniffing position, and I'm going to put them on the vitals machine. So I want to obtain a set of vitals. I want breath sounds, respiration rate, pulse rate, SpO2, capnography, blood pressure, and I want them on the EKG machine or ECG machine at all times so that I can monitor them throughout the duration of the whole suctioning event, and as well as pre and post. I'm going to go ahead and open all my supplies right now so that when I'm sterile, I don't have to become non-sterile. So water, I want to pour that into the basin. I want to open my lubrication jelly and pour that into the sterile field. I want to go ahead and make sure my suction's set at 100 to 150 for the adult. I want to go ahead and check my BVM at this time, make sure the oxygen wall mount is there and that it's working, and check the BVM. So once everything's set up, I can go ahead and don my PPE. So patients on the vitals machine, vitals are looking good. I determined that he needs suctioning. I'm going to go ahead and don my PPE. First glove that I want to grab. I want to pinch the cuff, so just the cuff, pick it up, away, slide my hand in. I'm only handling the inside of the cuff at this time. With my second hand, this is going to be now sterile. I'm going to go under the cuff, so only touching the outside of the second glove, put that hand in. Now if I want to readjust, I can go sterile to sterile. I'm now good. I'm going to go ahead and grab my suction catheter and wrap it around one of my hands. This is going to be my sterile hand. I'm going to take this sterile hand and I'm going to make it a clean hand by grabbing the suctioning tubing. I'm going to plug that into my catheter, and now this hand is clean. It is no longer sterile. So I'm going to go ahead and check the suctioning. I'm going to go put it in the water, test it, make sure that it's sucking. I want to make sure that my suction is set at 100 to 150. If it's working well, I'm going to go ahead and lubricate the tip. I'm going to go ahead and advance it to the patient's nose. So I'm going to advance it into the nose and the nasopharynx. Once I feel resistance, I'm going to be at the vocal cords. So once I'm here, I'm going to wait for a cough. I'm going to advance it past until I feel more resistance or the patient begins to cough. At that point, I'm going to go ahead and do intermittent suctioning all the way out in a circular kind of twisting motion. I don't want to pull it all the way out. I want to stop right before the vocal cords in case I have to re-advance. I don't have to repass the vocal cords. I can just continue. I'm monitoring the patient throughout the whole suctioning event. So if they are unable to tolerate, I'll pull it out immediately. If they are and they do indicate more need for suctioning, I can go ahead and re-advance at this point, giving them a little break and going back down. If they are all good, I can go ahead and withdraw at that time. So I'm going to go ahead and withdraw it nice and slowly so it doesn't fling anywhere. Suctioning on the way out, always intermittently. And once I'm done, I'm going to go ahead, if the patient has no more need for suctioning, I can go ahead and wrap this up at that time and throw it away. Once I'm done, I want to go ahead and reassess all their vital signs. So I want their breath sounds, SpO2, capnography. They're still on the heart rate monitor. I want the blood pressure as well as their heart rate and their heart rhythm to make sure there's no adverse reactions. Their general signs should be better as well. So at that point, we're all set. I can go ahead and wash my hands. I'm going to chart any pertinent information, any data, make sure the patient tolerated it, make sure there's no need for more suctioning. I'm going to go ahead and document what I suctioned, so the color, odor, consistency, and amount of the secretions as well. And I can go ahead and set the patient back up with anything they may need, they may have had before I entered, and kind of help get them situated before I exit the room.